Good evening, guys. This is Dr Vinayak Rengan. I'm a MCH resident in pediatric surgery at SMS Jaipur Medical College. And I have completed my MS General Surgery from Madras Medical College. My MRC is from Royal College of Surgeons of Edinburgh. And I'm doing MCH in pediatric surgery. And I'm also the founder of Surgtest. So, Surgtest is a platform which helps surgeons and physicians clear MRCs and need super specialty examinations. And, we have been providing guidance for residents and uh, surgeons, physicians for the past 2 years now, and we've been pretty successful in giving relatively good advice, helping them solve MCQs, and giving them good media lectures. So today, I'm going to talk about a major problem. This is, should you do MS or DNB General Surgery? So there's been a hell lot of misconceptions. There'll been a lot of people would have been told you that yeah, MS karo, DNB mat karo, don't do DNB. MS is a superior degree. MS is from a government medical college. DNB is just from private hospitals. There's a hell lot of misconceptions, and I want to clear those misconceptions, and I want to talk about what really is there. A lot of senior people might have disagreements with me, but I mean, ultimately, you will have to base your choices on what you feel is right. So, the best thing I would advise you is listen to me, but don't base your decisions just based upon me, because you have a lot of people to please: your parents, your family, your girlfriends, your spouses, your boyfriends, or whoever is in your life. So, just don't base your decisions on me. So, let's address fundamental questions. So, MS or DNB. So, MS is awarded by universities. Your Indraprastha University, Delhi University, Tamil Nadu MGR Medical University, Maharashtra University, and DNB is awarded by NBE. And both are accredited by MCI, or what we call as NMC now, accredited. So, at the outset itself, I want to tell you by starting, both these degrees are equivalent. There are a few minor differences, but we'll be discussing about them in detail. So, again, a lot of people might tell you that MS is from government medical college and DNB is from private. This is again another misconception. So, MS can either be from government or private. So, universities such as Manipal, Ramachandra, they also have their own MS degree programs. Private, MAMC, Madras Medical College, Safdarjung, or VMMC, which is Safdarjung. So, all these things award again an MS program. So there are certain exceptions. So certain government hospitals also do offer a DNB program. So this is again the thing. And DNB is awarded by private hospitals mostly. So private hospitals, as in railway hospitals, semi-private or trust hospitals, or Durlabji SDMH Hospital in Jaipur, or Sir Gangaram Hospital in Delhi. So these are all places where you have your DNB general surgery programs. So, are they equivalent? Technically, yes. So, an MS is awarded by a university which has an academic program, an MBBS degree program, and other specialties. A DNB is provided in a private institution, or sometimes a government institution, or a trust hospital which has a functioning academic department. There will not be MBBS seats usually in a place where DNB is offered. We will not be discussing much about other specialties. We will be discussing about general surgery in specific. So, certain key uh, doubts come when we are talking about MS general surgery and DNB general surgery comparison. So, for a surgeon, one of the primary aims remains whether there is enough adequate hands-on. Whatever surgery, your surgery chiefs might say ki hands-on is not that essential. You need to see surgeries. If you learn from the master, see, you will be able to sing. I feel that that's a hell lot of bullshit. You definitely need to operate, and operating on your own, initially supervised, then unsupervised, makes you a better surgeon, because whatever people say, unless you are able to solve your problems on the table yourself, you're not be you will not be in a position to handle these when you practice independently. So, in terms of hands-on, is MS better than DNB? Again, this is a broad generalization. In most government hospitals, hands-on is excellent. Excellent. You take Safdarjung, you take a smaller medical college in Miraj, or you take it in a medical college, Thoothukudi Medical College, or you take Gorakhpur Medical College. All these places, first, from a surgical point of view, you will be doing a lot of emergency surgeries, a reasonable amount of elective surgeries. Okay. Hands-on can be divided into three categories. Septic cases, your diabetic foot amputations, diabetic foot, emergencies, general surgical emergencies, and electives. So, in these three categories, septic cases, all government hospitals will have an extreme amount of hands-on. Emergencies, government hospitals are meant for emergencies. You will be operating quite a bit. In terms of electives, most government hospitals fare reasonably well. But even now, even in cities, even in major cities like Chennai, Bombay, Delhi, Kolkata, in many places, laparoscopy exposure is questionable. In many government hospitals, you will have good laparoscopy exposure. I'm not saying that laparoscopy exposure in government itself is bad, but in a lot of places, you will just be allowed to hold the camera. In some places, laparoscope machines also don't work. Let's compare DNB. In a DNB program, septic cases, yes, you will do, but not as much as a government hospital. It depends from hospital to hospital, but usually, as diabetes increases among the poor populations of the country, septic cases, yes, but septic cases, a lot of you guys don't enjoy it. That's a pity because you learn a lot in sepsis by managing your diabetic foot. You'll learn to manage decay in a surgical patient. Emergencies, in most hospitals where there is DNB, emergency load is less. But if you go to a DNB offered in a private hospital, in a trust hospital, or in a place like what do you call Hindura Hospital in Delhi, which is basically a government hospital, or Baba Sahib Ambedkar Hospital in Delhi, which are basically a state government hospitals or municipal corporations offering a DNB program, emergency load is also extremely good. So again, it is not DNB program which has less emergencies or anything like that. It depends from hospital to hospital. Again, there are places where there is an MS degree program, such as private hospitals, where emergency load and septic cases load is going to be very less. When it comes to electives, DNB programs are uh, it's a completely heterogeneous sample. In some places like Gangaram, some of the great hospitals in Chennai, Railway Hospital, Isabel Hospital, some of the amazing places in Bombay, Ruby Hall Clinic in Maharashtra. So all these places, the elective load is amazing. You get a very good amount of laparoscopy exposure as well. So laparoscopy is usually three ticks in most of the DNB hospitals, many of the DNB hospitals. But again, if you go to DNB hospitals, which are run in trust hospitals, in government hospitals, many times the laparoscopic equipment itself does not work. So again, it's a mixed bag. I'm not going to be talking about specific hospitals in this video. You can contact us separately, learn about it, and you would have gained a lot of information by talking to your friends. So you should try to understand what is the septic hospital, septic case load over there, the emergency load in the hospital, and electives before filling up your choices. So this is about hands-on. Second, we will be discussing academics. Academics is a major issue in most hospitals. So a lot of people have this misconception that in DNB hospitals, academics is excellent, while in government hospitals, academics is low. Again, this is a major issue because academics is poor almost uniformly throughout India. We have amazing teachers on online forums such as Professor Kanagavel, Professor GD Sharma, who take classes on forums such as Learning General Surgery and stuff like that. But honestly, the amount of academics in government hospitals is also something of a major question because most people are what do you call refuse to teach and have organized proper classes or sessions. Again, research is a major issue, except in colleges such as AIMS, and certain central institutes, research is a big zero in India. In most hospitals, the thesis you present are all plagiarized, and that's a really a cause of concern. Surgeons feel that research is not important, but let me assure you, a good researcher always makes a good surgeon. And a good surgeon should ideally indulge himself in good research, because evidence-based medicine is the cornerstone of modern surgical practice. Because gone are the days when people just talk from experience. So. It's the era of evidence, not just the era of eminence. Like, just because your professor is an eminent guy, it does not mean that what he says is right. So in the era of it is the era of evidence, not the era of eminence. So in terms of academics and research all over India, it's a big zero. Central government evidence institutes are slightly better. Certain state government medical colleges who have good faculty do a good job, but I think academics overall has to improve. There are a lot of societies, Delhi State Surgical Society, the Tamil Nadu ASI, the ASI, the local associations of surgeons of chapter in Bangalore. They organize very good CME, so most of your academics is learned from conferences, exam conferences such as these, rather than your actual teaching in your institutes. Again, a major issue is bond. Except Delhi, most of the state medical colleges have started issuing a bond. There is almost no bond in DNB, which is of major advantage. So, if you don't want a bond, if you want to finish your MRCS or go abroad, go to Dubai, go to Australia after your surgical program, I would suggest that if your rank is not too good to get into a college in Delhi, I think you can choose DNB. Again, the lifestyle. It is overall considered that seniors are less abusive in DNB programs, and because you're more so in the hands of consultants. But again, I have found that in many places, consultants tend to abuse their position of power even in DNB programs. They don't really tend to teach. Most of the times, the resident is left to himself doing scut work in many DNB programs. Again, the same thing happens in a lot of MS degree programs. A lot of your consultants tend to abuse you and use you for the personal work. This is a very sad situation in India overall. But at the other hand, I want to say that a lot of DNB programs have fantastic surgeons, fantastic teachers, some of the best names in the surgical community who are who invest a lot of their time in teaching. The same thing goes in MS. A lot of professors these days are also very interested in teaching, and I find, I mean, it's a very interesting trend that a lot of teachers tend to compete on forums. I teach so well, my results so great, and I think that's a very encouraging trend overall. So. The final decision is that MS and DNB are equivalent. There are certain things like if you're applying for a medical college post in a government medical college, if you're not done your DNB in a smaller hospital, if you've done your not DNB done your DNB in a hospital with at least 500 beds, you might have to do 1 year of SRship before they are eligible to work as in a government medical college. But for most people who are applying for an MCH, there is no problem. MCH, there is application. There is no difference between DNB and an MS, and there's an equivalent of DNB in super specialty, which is called DRNB. It was called DNB before, now it's called DRNB, which is Doctorate of National Board, which is again equivalent to an MCH. Again, there is no difference in corporate hospital or in most teaching hospitals. So if you're getting in a good place, you can choose a DNB. Again, let's come to the last point, which is a very crucial point, which tilts a balance in favor of MS, is the examination pattern. The exam in DNB is conducted by NB, so it's a centralized exam. Centralized exam. You don't have anyone helping you. In MS, it's conducted by the university, and it's an internal exam. It's like not exactly internal, but the internal examiners, people who know that you worked in the department, will be there. In a DNB, nobody will care how hard you worked, how good you've been to your seniors, how good you've been to your consultant, and so that's just a slight disadvantage. But with the new ASCII pattern, in DNB practicals, it has become a little easier to pass DNB. The pass percentage in DNB was pathetically low, say about 10 to 12 years ago. Over the years, the pass percentages have increased, and almost right now, around 70 to 80% people tend to pass their DNB exams. So that's a very encouraging trend. In MS, the pass percentage is almost 95 to 100%. So that's a major advantage if you're looking at MS. But if you're getting into a good DNB program compared to a mediocre MS, I would advise you to go for DNB rather than an MS in those kind of scenarios. If you're getting into a good government college with a very less bond period, then you can also go for an MS. But it depends again on your rank. Guys, you can subscribe to the like, subscribe, or whatever. Press the bell button on the Surgtest channel. And if you have any doubts, you can put them in the comments, or you can mail us at info@surgtest.com. Info at My handwriting sucks. I know that. So, if you found this video in English a little difficult to understand, if I do have enough requests, I can do this video in Hindi and Tamil as well, as I've done for a couple of previous videos. So, thank you so much, guys, for listening. I think I've spoken about most important points which people ask. Regarding specific colleges or hospitals, you can contact us, and we'll be more than glad to help you out. Thank you so much, guys.